Hello viewers. How are you? This is Rishi. Doesn't anyone forget Corona? You follow the same safety rules, don't you? In an emergency, the first thing that comes to mind is advice from family and friends. But there are times when even such public advice, which we often hear and see, goes wrong. So in this video, we present some common misconceptions about first aid and what you should do in case of an emergency. Placing ice on the site of a bruise. Why is it wrong? Although ice can reduce bruising, placing ice directly on the skin can burn the skin due to extreme cold. How to do it right? Place a piece of cloth between the skin and the ice. Cool the batter for about 20 minutes, remove from the heat and leave for 20 minutes. Repeat this process several times. 2. Rubbing a person with a fever with alcohol or vinegar. This method, which is commonly used in the West, uses alcohol or vinegar to wipe a person with a fever. Why is it wrong? Alcohol and vinegar can be absorbed into the bloodstream through the skin, and alcohol can cause intoxication and vinegar can increase the acidity of the body. This is especially detrimental to young children. How to do it right? Drinking plenty of fluids and cooling the room 61-64 degrees F can automatically lower the temperature to very low. 3. Lifting a fainting person. Why is it wrong? When a person faints, do not try to lift him or spray cold water on his face. It can make the spasm worse. Do not allow the person to drink coffee or energy drinks after regaining consciousness. Such caffeinated beverages can cause dehydration. How to do it right? Raise the faint person's legs slightly above them and loosen tight clothing, including buttons. Do not allow the person to stand still as soon as he regains consciousness. 4. Using butter to treat burns. Why is it wrong? After applying butter or sour cream for a minor burn, you will get some relief only because the ingredients are a bit cold. But the danger here is that after the butter or oleosin dries, a small film forms and interferes with the heat transfer. Then the heat of the burn can penetrate deeper and cause more damage. How to do it right? Hold the burn area in running cold water for about 15 minutes. Avoid bursting blisters at any point, as the protective covering of the wound may be removed and it may become infected and ulcer. 5. Replacing severed bone yourself. Why is it wrong? You should never repair a severed bone yourself. It can cause more and more damage. How to do it right? Keep the dislocated limb immobile and take the patient to a hospital. The bone should never be forcibly adjusted. Instead, wrap the limb in a comfortable position so that the fractured bone and the two adjacent joints do not move. 6. Applying heat to a sprain. Why is it wrong? When a sprain occurs, the area cannot be relieved by rubbing it with a warm cloth. Instead, heat can strengthen the bloodstream and cause more swelling in the area. How to do it right? In the first few days after a sprain, replace it with heat and let it cool. It can reduce swelling and pain. During the first 48 hours, apply as little pressure as possible to the affected area. 7. Vomiting when toxins are ingested. Why is it wrong? When a toxin is ingested, vomiting is usually advised. However, vomiting should not be performed if the toxin is acidic, alkaline, or flammable. How to do it right? Call an ambulance immediately. Do not use manganese, baking soda, or milk to stimulate vomiting if you feel it is appropriate. Drink plenty of hot water instead. 8. Dealing with an eye-catching foreign object. Why is it wrong? There is a risk of accidents due to the incorrect movement of your hand. How to do it right? Cover the eye with gauze and go to a doctor immediately. Rinse the eye immediately with water only if the contaminant is a chemical. If you want to know more about it, we have made a video on how to remove a foreign object that has fallen into the eye. I will put that link on the card at the top. 9. Pulling out foreign matter from a wound. Why is it wrong? Even if you can pull out something like a thorn in your hand, a small piece of glass, Never try to pull a knife or any substance that could cause such a serious injury out of the wound. Even doctors keep the fluid intact until the patient is operated on. Pulling out such a substance can cause fatal bleeding. How to do it right? No matter how dangerous an object such as a knife or thorn sticks to the body, instead of trying to pull it out, take the patient to a hospital immediately while it is still there. Well, then I think you have learned something important from this video. If you have anything to know about this, please comment below. Also, don't forget to share this video to let others know. Thank you for watching.